And tonight, Congress appears to have a deal on a relief plan. House Speaker Nancy Pelosi spent the past 24 hours in intense negotiations with the Treasury Secretary. ABC's Mary Bruce is on Capitol Hill. Mary, we're hearing there's a deal. What does it look like?
Diane, the Speaker has just announced that they have reached an agreement. This is a bill that's intended to provide immediate relief to Americans who are suffering from coronavirus. It would include free coronavirus testing, also enhanced paid family and sick leave, and it would boost unemployment insurance. It would also include measures to increase food security across the country, but it does not include several measures that the president has been demanding, like a payroll tax cut. Now, both Speaker Pelosi and the Treasury Secretary agree that there could be additional bills and measures in the coming weeks. And Diane, they have spent the last 24 hours in intense negotiations, the two of them speaking more than a dozen times just today to try and hammer all of this out. The House is going to be acting on this tonight, and then the Republican-controlled Senate will be following suit on Monday.
Well,
Diane.
Good to hear about action out of Washington. Mary Bruce from the Capitol, we appreciate it. Thanks. And one of the lawmakers who will be considering that proposal is Texas Senator Ted Cruz. But he is under self-quarantine right now and joins us now by phone. Senator, thanks for talking to us.
Diane, it's good to be with you. Thank you for having me.
So I understand that you had to extend your quarantine after you learned of a second interaction. How are you feeling right now?
I'm feeling terrific. I have no symptoms. I'm in good health, but I'm trying at the same time to be cautious and prudent. And the quarantine came about from two separate interactions. 2 weeks ago at the CPAC gathering, I interacted, I visited with and shook hands with a person who subsequently tested positive for coronavirus. I was informed of that 9 days later. When I found out about that, I spoke with the CDC, I spoke with the HHS, I spoke with the health department in both the city of Houston and Harris County, where I reside, and I spoke with my own doctor. Based on their advice, they concluded that I did not meet the CDC criteria for self-quarantine because the encounter had been brief and it had been 9 days without symptoms. Nevertheless, I decided in an abundance of caution to impose my own self-quarantine, and so I spent the remainder of the 14-day period in my home away from other people. That self-quarantine ended yesterday, so I was happily looking forward to tonight taking my family out to dinner and ending the quarantine. And then, unfortunately, I found out last night that a second person I had encountered, a Spanish government official who had come to meet me in my office in D.C., had tested positive for coronavirus last night. And so as a result of that, I decided to extend the self-quarantine for 14 days from that interaction. That will expire on March 17th. So I am once again sitting at my home but working from home and engaging in the government response to this growing public health crisis.
And have you been tested yet, Senator?
You know, I have not, and the reason is each of the physicians that I've consulted with advised me that since I have no symptoms, since I'm not sick, they said testing was medically ineffective, that you have to have a sufficient viral load for the test to work, and so the advice of the physicians was not to get tested, but simply monitor, and if I encountered any symptoms and got sick, then they said testing made sense. Now that being said, I think we need to do much more to make tests available widely and publicly, and I think we've made major steps in the last 48 hours in that regard. In particular, seeing private labs stepping forward to fill some of the capacity. But I'm urging the administration, I'm urging Congress to make the tests widely available so that anyone who is experiencing symptoms can be tested. We also need to improve protective gear for first responders, protective gears for health professionals, to expand the accessibility to that, to make sure that we have enough. And we need to improve our health capacity. If you look at what has happened in countries like China and Iran and Italy, we've seen their health system overwhelmed. And so I've urged the administration to give hospitals, to give our health system the flexibility to expand their capacity and also to improve things, expand their inventory of things like ventilators, because if, God forbid, we see a dramatic increase in the number of people suffering from this public health outbreak, we need to make sure that we have sufficient medical equipment to care for them. And then finally, the fourth piece of the public health response that I think is very, very important is doing every step necessary to develop a vaccine and to develop treatment protocols and hopefully a cure. And so I am filing legislation to speed up the FDA approval process and in particular to pass legislation that I call the Results Act that says that any pharmaceutical device or medical device approved in another major developed country like Canada, like Europe, that the FDA has 30 days to approve it here if it is directed towards the coronavirus so that we can get the medical tools we need to defeat this epidemic.
Mm-hmm. And on that note about legislation, Senator, we're hearing that Nancy Pelosi says she has a deal on the current legislation before the House. Do you plan to vote for this legislation once it clears?
You know, I've seen that headline. Obviously, I want to see the specifics of the deal. I don't know what Speaker Pelosi has agreed to. I will look at it very carefully and with great interest. I think Congress needs to act. I voted in favor of the $8.3 billion emergency appropriation that we passed a little bit over a week ago. I think that was the right step to take. I hope there are good elements in this deal, but until I see the specifics, I want to assess it on the merits.
And, you know, you were talking about some of the areas that were lacking before. One big area of concern was the lack of testing to this far. Do you think more tests should have been made available to Americans by now?
Undoubtedly, and there are areas in the public health crisis that I think the administration has done well. There are areas where they have not done as well, and they need to do better.
So when you heard today President Trump saying that he takes no responsibility at all, what do you make of that?
Well, look, I think the rollout of the tests was clearly problematic. There were mistakes in terms of the efficacy. There was contamination within the CDC facilities that made the tests less than effective, and they haven't been delivered across the country with the speed and efficiency that they should have been. Now, that being said, in any public health crisis, it is a complicated and difficult challenge to undertake, and so it's easy to criticize the process. What I'm focused on instead is how can we be more effective? How can we ensure that we get the tests where they need to go? And don't use this simply as a political football for one side or the other to advance their partisan objectives. And one of the keys that we've seen is private labs that have enormous capability, academic labs that have the capacity to develop test kits being engaged. And I think the bureaucracy was a little bit slow in bringing the private sector into it and empowering them and getting the red tape out of the way.
Do you think this is a solution now?
I hope so. I think we are moving in the right direction. But listen, this is a major public health threat, and so almost anything we're doing, we need to do more because this is a global pandemic that has taken lives all across the globe, and stopping it means one of the keys to stopping it is limiting its spread, and that means social distancing. It's one of the reasons why I decided myself to self-quarantine. The doctors advised me, based on the contact I had, that the likelihood of contraction of the virus was quite low. But I thought it was the right thing to do to minimize my contact with others so that if I had contracted the virus, I would not be at risk of passing it on to anyone else.
Well, Senator, we appreciate you setting a good example for your citizens, and we appreciate you taking the time to talk to us. We hope you continue to feel well throughout this.
Thank you, Diane. I appreciate it, and we're going to get through this. And as a country, we've endured enormous challenges before, and we'll overcome this one as well.
We have indeed. Thank you, Senator.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.